Okay, we'll go ahead and get started. We have a few more folks that might be jumping on, but certainly my introduction is not the most important thing. So I'll just say hello and welcome everyone to our grantee sites. We're just thrilled to have you here and interact with you again. Thank you for all you're doing out there, and especially for being our grant partners here. And for coming today. I'd also like to thank our Office of Mental Health colleagues who are going to be speaking with us today, and for agreeing to present to us this special information. And Jenna Heiss, I'm your CARES Up Project Director, and we've got our CARES Up team here as well. When we started talking about all the grant components, it became clear that we wanted to take time to devote 2 webinars to talk specifically to 2 issues that were kind of cross-cutting for all of y'all, not just your specific disciplines or groups or even individual grant sites, but something that we could put together that we felt needed to be highlighted as a whole for the CARES Up project. So one of them was about diversity and equity and inclusion. So that'll be the other webinar that we'll be doing later on this year. And then this is the other topic, which is about our crisis services, the most up-to-date information about that, and then about the 988 new number that started on July 16th. And so we wanted you to have the most specific and up-to-date information from the most in the know folks from our Office of Mental Health Crisis Services, which is Denise Balzer and Katarina Gaylord. And so without any further ado, I will turn things over to them. And I would like to thank you for coming.
Good afternoon, everyone. Thank you so much for having us today. We always look forward to talking about the Comprehensive Crisis Response System in New York State. And we're really happy to just do a quick overview of some of the planning that we've been doing, and then some specific information about 988. I want to introduce Katarina Gaylord. She is our 988.
Can you hear us? Can you hear me?
Yes. Yes.
Hello.
She's our 988 implementation master and the assistant director of the Crisis Services Bureau. I'm Denise Balzer. I'm the director of Crisis Services at OMH. So next slide. Okay, so when we talk about the Comprehensive Crisis Response System in New York State, we're talking about a system of care for individuals who are experiencing any type of emotional distress or behavioral health crisis. And this is for any New Yorker, regardless of their ability to pay. So as we discuss and talk about comprehensive crisis response, there are a number of elements included. And these services include the implementation of 988. That is the connection to the National Suicide Prevention Lifeline, and the ability to triage a call to provide counseling. And Kat will talk more specifically about the other services that are available through 988. It also includes the connection to mobile crisis teams. That means a mobile crisis response in the community by one or more individuals, a licensed professional, to provide stabilization in the community and a connection to services. That may be a connection to community services like a therapy or connection for housing or food or other services, or a transfer to perhaps a higher level of care, maybe an emergency department if needed. We also have crisis residential programs. Those are programs that are short-term for individuals experiencing a mental health crisis of some sort, up to 28 days. And there are programs for children and adults. We are in the process of developing crisis stabilization centers. Now, these exist in different forms at this point, in different parts of the state. There's one model that's like a behavioral health urgent care model, which can provide services from people suffering with anxiety up to individuals who need more of a medical response, like a mild to moderate detox or medication-assisted treatment or a psychiatric evaluation and medication. Or it could be as simple as a living room model where people go to help relax, stabilize, get some respite, and a connection to what services they've identified that they may need. We also provide comprehensive psychiatric emergency programs across the state. These programs are licensed by the Office of Mental Health. The majority of them are in New York City, but they are composed of an emergency room that's located in a hospital. There are emergency observation beds, and they also have a mobile crisis component as well. And that mobile crisis component can be mobile outreach in the community as well as follow-up in the community after an emergency room visit. Included in this system is the connection to other community services and supports. These could include treatment services in the community, outside of the community, whether it's in a therapy office, or it could be connection to food, connection to housing, connection to recreation. It could be whatever the individual may need to help stabilize their crisis. Next slide. So when we talk about the comprehensive crisis response system, we use these descriptors, right? So it's someone to call. So when you need someone in a crisis, you have someone to call. This could be 988, our regional crisis call center hubs. We call them our 988 crisis contact centers, or someone to come, the mobile crisis teams, and somewhere to go are these crisis residences, crisis stabilization centers, and CPEPs. So comprehensive crisis response system has 3 elements: someone to call, someone to come, and somewhere to go. Next slide, please. What we know about the alignment of crisis services is that when someone calls a 988 call or a 988 number, the majority of those people who call that number, their crisis is resolved over the phone. So they experience some type of resolution or connection to services, but they don't need any further crisis services. Beyond that 80%. For those 20% of folks that need additional call or additional services, 70% of that can be resolved in the field, which means a mobile crisis team may be deployed. And of those 70% resolved, they're discharged back to the community. And then of those 65 discharged back to the community, 85 are stable. But it's important for a response system to have all of these elements because individuals may need all those different levels of care. But what helps when you have this whole comprehensive crisis response system is that people get to the right place at the right time. So there's less reliance on law enforcement intervention when people are having a mental health or substance use crisis. There's less reliance on the emergency department to treat individuals whose symptoms don't require an emergency room visit. And there's less reliance in an individual being hospitalized. So when people get the services they need where they need them, that system is less, is used appropriately, and that individuals are treated in the manner that they need. So for individuals who call 911, the connection to 988 and our conversations about how 911 and 988 are connected will help us determine what the next steps will be. And Kat can talk about that more later. Also, one of the things related in this continuum is how law enforcement interacts with all these different components as well. So whether it's the 911 call, whether it's assisting a mobile crisis team or a response with a social worker or law enforcement, the ability for law enforcement to bring individuals to a crisis stabilization center versus an emergency room as we develop those types of services will really help decrease people being in a situation that could potentially cause a bad outcome for them, and also that we know that law enforcement doesn't want to be involved in these interactions that aren't necessary. That people should be treated with the professionals that have the most experience working with them. Next slide, please. So Kat is going to talk to us about our vision for 988 and its connection to crisis services. Thank you, Kat.
Thanks, Denise, and thank you, everybody, for allowing us the opportunity to share with you New York's newest crisis resource, 988, that went live nationally on July 16th, 2022. And what this slide really indicates is that 988 is a transformative moment for crisis care in the US, but it's more than just 988. It really is the alignment of all the crisis services that the nation is working on developing, and specifically here in New York, as Denise mentioned, our mobile crisis component, our crisis residential programs, the crisis stabilization centers, and the CPEPs, to ensure that there are other responses to behavioral health crises other than the traditional go to the medical emergency room and wait to have an assessment and hopefully be placed in the appropriate level of care. So the short-term goal for 988 is to just strengthen and expand the existing lifeline structure to be able to respond to individuals in crisis who are reaching out via call, chat, or text. The lifeline began in 2005, so a 988 is really just not quite a rebranding of the lifeline. It's just a new number to be able to access those services. And with that long-term vision of having a robust crisis system that can respond to any individual, regardless of the crisis that they're experiencing at any time in any city across the nation. Next slide. So this is a visual that has been borrowed from SAMSA as we look at the development of crisis services across the nation. And it does apply to what we're working on here in New York. And it's divided up into these three horizons that are very similar to the someone to call, someone to come, and somewhere to go model. And that first horizon is where we're at now with the development of these 988 crisis contact centers, and that's the someone to talk to. And the overall goal for New York is to have about 90% of all contacts made to 988 that originate from New York to be responded to by a contact center in New York. This is a system that cannot be developed overnight, although we're quite excited that July 16th has come and gone, and I'll share with you a bit about how that went. The development of these other response systems will take time on these horizons. So we're looking at a kind of a national model, but that by 2025, with Horizon 2, will be the comprehensive mobile crisis services well embedded within every community. And that's the someone to respond, with the hope that about 80% of all individuals who are in crisis can have rapid access to these mobile crisis teams and their communities, so that there does not necessarily have to be police intervention, or that this individual doesn't have to present outside of their home for a crisis response service. But should the individual require more than the telephonic triage through 988 or the mobile crisis response in the community, on that Horizon 3 are the development of those stabilization services so that an individual will have someplace to go, with the hope that by 2027, so in about 5 years, there will be well embedded access of these stabilization centers in all communities across the nation, not just in New York, for individuals to go and receive that very peer focused, recovery oriented service for their stabilization of their mental health or substance use concern. So that's kind of the vision for where 988 fits into this larger crisis services development. And right now we're on Horizon 1, with certainly enjoying the view of the next two horizons while we plan for that. Next slide. So we'll spend a bit of time today just giving a background of 988. I'm not sure how familiar individuals on this call are with 988. So we'll give you a little bit of background about 988 nationally and the work that we've done in New York to implement this program. So in October of 2020, the National Suicide Prevention Designation Act was signed into law, which is really just transforming that 10-digit number that was the National Suicide Prevention Lifeline into this easy to remember 3-digit dialing code that can be accessed via landline, cell phone, anywhere in the US. What we like to remind individuals is that 988 is a free and confidential emotional support service. So you do not have to give your name if you do not wish to give your name or any other information about you when you're contacting 988. It's really just a number to be connected to trained counselors to talk about what's bothering you. We also like to just remind everybody that although it was called the National Suicide Prevention Lifeline, 988 is more than just a suicide prevention number. It is for any type of emotional distress or crisis that an individual is experiencing. And we really leave it up to that individual to define what that crisis is. So a crisis for me may look different than a crisis for Denise, may look different than a crisis for Kathy, but that's not up to the counselor to define what that crisis is. It's up to that counselor to help that individual recognize the steps that they can take to be well in the community and get them linked to the care that they need. It's a shorter, easier to remember number. I still, after doing this work for over a year and a half with 988, without looking at the 10-digit number, can't tell you what the 10-digit number is, but I can say 988 a million times a day and know exactly where it's going. And on the bottom here, we just wanted to point out that the logo, the green logo on the left, that's the National Suicide Prevention Lifeline, is very likely what you have been seeing for the past several years for how to access this, but it has now transitioned to a logo or a variation on the right for the 988 Suicide and Crisis Lifeline. So as you begin to familiarize yourself with 988, you'll see the transition of that one logo to the new one. Next slide. So some key points about 988 is that this is, again, a national initiative. We're talking a bit about the work done in New York, but as New York was preparing to transition the 10-digit number of the lifeline to 988, so was every other state and territory in the US. And the work that's being done in the other states may look a little bit different than what we've done in New York because it's really been responsive to the needs of the communities and the states that were implementing this. It's also considered a public health service because when an individual isn't feeling well, they should be able to reach out for the help that they need from the most appropriate intervention that's possible. So this is now really putting a focus on the prioritization of mental health and substance use concerns on the same level as physical health concerns. We're considering the 988 contact centers, this hub or single point of access for lower cost crisis services. So again, 988 is a free and confidential service, and it really can help individuals, direct individuals to the best level of care for them, often resulting in less involvement of law enforcement, an EMS response, or an undue hospitalization visit, either in the ER or psychiatric admission. And that this will be kind of implemented in phases. So we talked about the horizons because this really is a broad range of these community services to be able to respond to these mental health needs. So just some key points. Next slide. So about a year and a half ago, New York began the endeavor of implementing 988 in New York State. And what we did is we focused on these 8 key components that you see on the screen here through a coalition that was divided out into 4 subgroups to really look at each of these 8 implementation components and figure out how they best fit into the landscape of New York. So things that we knew, that 988, in order for it to be successful, required 24/7 statewide coverage. People don't go into crisis just between those 9 to 5 hours, Monday through Friday. People can go into crisis at any time of the day, any holiday, any weekend, and there needed to be coverage to be able to support the individuals who needed that assistance at any time. We also needed to identify funding to be able to support 988. The National Suicide Prevention Lifeline would give each contact center a minimal stipend to be able to have that contract with the NSPL to be able to connect them. But it was really up to these independent contractors of each contact center to provide that funding for this really life-saving intervention. So as 988 became more of a state responsibility, the state had to identify the different funding streams to be able to not only support the existing volume of the National Suicide Prevention Lifeline, but begin to prepare for what was expected to be a significant increase in volume with the implementation of 988 through the call, chat, and text. Because each contact center was independently operated and contracting with the NSPL. It was also really important to make sure that New York was looking at each of the contact centers with consistent operational, clinical, and performance standards, that we were holding all contact centers to the same level of expectation so that they would be able to intervene with individuals in crisis, and people who are contacting them, regardless of who they connected to, would receive that same level of care. So we began looking at who was doing what and how, based on some pretty stringent guidelines that they had as part of their NSPL contract. And what we learned through this process is that all of these contact centers are also accredited by a larger body in crisis care, either the American Association on Suicidology or the International Council for Helplines. So they're held to a bit of a higher standard than perhaps local crisis lines. And we knew that with 988, there would be a migration of volume from other systems like local hotlines and 911 as a way for individuals to easily access mental health services, as opposed to dialing 911 when somebody was in a crisis. This would provide individuals an opportunity to connect to a mental health driven system to be able to address a mental health need. So we needed to really understand what this looked like in New York with the different 911 PSAPs, law enforcement, EMS, and how that component of emergency response fit into what 988 was doing. So we had one of our subgroups was focused specifically on the 911, 988 protocols and interface to really understand what the opportunities for bidirectional trainings and transfers of calls would look like. Through that process, we learned that many individuals from 911 and law enforcement and EMS really do not want to respond to mental health crises, which was helpful to know because many individuals experiencing a mental health crisis do not want law enforcement to be the first responder. So that was a really nice segue into how can we ensure that people experiencing a police, fire, medical emergency get to the access that they need, and those experiencing a behavioral health or substance use, mental health crisis get the service that they need, and to free up the systems to be able to best respond to their expertise in the community. Follow-up services is also a really important component of 988. So what we know is that an individual, about 80% of individuals feel that after they connect with a counselor on a hotline like 988, they feel better. They feel like their crisis has been resolved and that they can continue on without any additional intervention. But many also report that it would be nice if somebody could check up on them. They may not need a mobile crisis intervention. They may not need to go to a crisis stabilization center. But in a day or two, they might want somebody to reach out and just make sure that they're still doing well, make sure that they've connected to any referrals or linkages in the community that could assist them with their mental health recovery. So as part of the 988 service, there is the option for callers to consent into a follow-up program to either receive of their choice, a call, chat, or text back from a counselor at 988 in an agreed upon set of time, just to make sure that they're continuing to do well or might need assistance getting linked to services. And then the big one is really this consistency in public messaging. So 988, because it is a national movement, there is a lot of national attention, but states are doing things kind of on their own timeline. So we've worked quite a bit on the just consistency in this public messaging to ensure that we're kind of sticking with that national alignment of what 988 is, but also ensuring that we are appropriately communicating to New Yorkers what 988 looks like in this state. Next slide. So I'm not going to go through all of these, but on July 16th, these were our top 5 priorities to be able to ensure that we would have a system that we could be proud to say is successful of a connection of 988 in New York. So I'll let you kind of look through those because we'll talk about these on the next slides. You can go to the next. Thanks, Kathy. So what does 988 look like in New York? So our current landscape, we have 13 active crisis contact centers. They're spread out across the state. Some contact centers have the responsibility of covering 20 plus counties, and some contact centers cover 1 county, and they have different capacity for what they're able to do and who they're able to serve based on the volume of calls that originate from that county, the size of that county, and the other services that they have available. But we have all 62 counties in New York State are covered by one of these 13 active crisis contact centers. We're also in the process of developing 2 new crisis contact centers, one for the North Country and one for the Capital Region. Through the planning process, we really honed in on the fact that there were 8 counties in New York that have never been connected to the National Suicide Prevention Lifeline. So of those 8 counties, mostly located in the Capital Region and North Country, what that would mean is if somebody lived in those counties, like I live in Schenectady County, so and that was one of our uncovered counties. So if I contacted NSPL, I would get routed to a national backup system. So it's not like my call would have gone unanswered, but it wouldn't have been answered by a contact center in New York State. And likely that contact center wouldn't know the landscape of New York, the resources available, and it just wouldn't be as personalized of an experience. So part of the planning process was really to ensure that not only could all of the contact centers or all individuals reaching out to 988 from New York would connect to a contact center in New York, that there would be dedicated contact centers to specific regions so that they would really become part of the footprint of those regions, understand the landscape, the needs, the challenges, opportunities of those regions, and be able to successfully connect the callers, chatters, and texters to those resources. We also have 2 crisis contact centers in New York that are currently engaged in the national 988 chat and text system. So there is, again, that national backup system. So if an individual reached out to a contact center and they weren't able to successfully connect to one in their own state, there is the safety net of contact center. So everybody's call does get answered. And 2 of those of the chat and text are from New York State, which we're very proud of. One of those contact centers also provides the chat and text for New York State. We have currently chat and text between the hours of 4 a.m. and noon, and we're working on expanding that as the contact centers just get acclimated to this new chat and text service offered through 988 and continue to expand their capacity. Next slide. So this is just a map of our coverage of the 988 contact centers in New York. We're fully covered by primary contact center, so we're really excited to be able to offer that and state that for the July 16th go live. And you can see that there's some counties that are outlined in yellow. Those are the 8 counties that many of those are the 8 counties that didn't have that in-state coverage prior to 988. And that's where the 2 new contact centers that are being developed will cover. Because they aren't yet developed, one of our existing contact centers, which is called Contact Community Services located in Syracuse, has picked up those counties to be able to respond to the individuals who live in those communities when they contact 988. Next slide. Part of the planning for 988 also involved that funding to make sure that this was a sustainable program and that we could be able to consistently offer 988 service, high quality 988 service in New York State. So I've been fortunate in our state to have various funding for 988. First and foremost, the governor's executive budget included $35 million in this budget cycle For 988 contact centers, growing to 60 million annually to be able to support the contact centers, expanding their capacity and being responsive to New Yorkers in crisis. New York OMH also put in $10 million of mental health block grant funding. 6 of that went to existing contact centers to help them prepare for their readiness and expansion. 1 million went to existing contact centers who were part of a capacity building grant for the past few years to be able to build up for this 988 launch. And then 3 of that million is going to the development of the 2 new contact centers. And then we also were awarded a grant by SAMSA in the amount of $7.2 million over 2 years that come from ARPA funds to be able to support the contact centers and their workforce development. So this is a significant investment, one of the most significant in the state, coming from this level of resource programming to be able to support 988. Next slide. We've also had some really great collaborations in the 988 planning process that historically may not have existed without this modality of being able to provide crisis services at this level. So we've had, for the past about year, some ongoing communications with the Department of Homeland Security and Emergency Services, particularly around targeted violence initiatives, to be able to really identify how 988 contact centers can play a pretty significant role in helping mitigate threats and identify threats and keep communities safe and connect with our partners in law enforcement and criminal justice services to be able to easily and early identify any concerns that could arise, like active shooter situations, school shooters, bomb threats, things like that. We've also had conversations with the Division of Criminal Justice Services to really hone in on the fact that for decades, police and law enforcement have been that de facto response to mental health, and to really start shifting the community response for mental health coming from a mental health model and allowing law enforcement and police to focus as much of time in their attention on interventions that require the law enforcement and police more so than a behavioral health response. We've also had really great meetings with the 911 PSAPs across the state. We learned that there's over 174 unique PSAPs across New York, which they all operate a little bit differently. So we've had some really great conversations with just learning about the different 911 PSAPs in each of the communities and how those PSAPs can work collaboratively with the 988 contact centers in their regions to be able to offer the best services for the types of emergencies that people are arising. I know that Jenna had said that you'll be having a webinar down the line on diversity and inclusion and access and equity, but we've been working quite closely with our OMH ODI office on just ensuring that as we build out 988 and all crisis services across New York, that we're keeping access and equity in the forefront of all of our planning efforts. And then just targeted meetings with special populations to recognize that LGBTQ+, BIPOC, tribal nations, Asian American communities all have specific and unique needs surrounding crisis response. And in order to be able to say that we have a responsive system to all New Yorkers, we really need to understand the needs of all New Yorkers. So we'll continue these collaborations well on into our crisis services planning and development. Next slide. We've also worked on some different resources and statewide considerations for training. So we're really excited to be able to develop a training platform for crisis services that we hope to be able to someday perhaps offer all of you as we work on developing high quality trainings for individuals responding to crisis, and recognizing that this could go beyond just mental health professionals, but to our partners in law enforcement, uniformed personnel, schools, really any individual who might be faced with an individual in crisis and how to best support them. We've also formed a crisis data coordination council to be able to look at some trends and data that we're seeing for individuals who are using 988 and the other crisis service components to be able to identify gaps and challenges in where who we are serving and who we're not serving, and understand why we're not serving those communities to see if we can improve on that. Again, with technology, probably like most 911 systems or law enforcement systems, each contact center right now has pretty unique technology. As we move forward with the implementation of these crisis services, really looking to see if we can have a standardized technological platform to be able to best communicate the needs of the individuals to get them to the next service seamlessly. And we know that information sharing can be one of the barriers. And then just ensuring that we have the most up-to-date resources, referrals, and linkages in each of the communities so that if an individual is connected to a contact center that doesn't immediately serve their area, that they can still be linked to the best resources in their communities without any disruption in services. Next slide. So the educational and marketing plan for 988 for the launch of 988 in July was really considered what we're calling a soft launch. We aren't widely advertising 988. The nation has kind of done a good enough job for that. But in New York, we really wanted to ensure that the contact centers have the capacity to respond to that increase of volume. We were expecting about a 30% increase in call volume. And we don't want to overpromise the system and under deliver, because that would just discourage people from utilizing this, and we don't want that. So some of the things that we prepared for the soft launch was just the governor gave a press release talking about 988, the role of the implementation in the contact centers. We'll be sharing some infographics that come out from OMH as well as SAMSA on what 988 is and how to access it. Some social media graphics that, again, some have gone out, but we'll continue to share some of that. And then just some, New York State Fair promotion of what 988 is and just education and really being able to have conversations about it. So we don't want to just throw out, this is 988, go ahead and call it. We want to be able to offer an opportunity to explain what it is and make sure that there's some personal connection to how 988 can be useful to individuals in crisis. Next slide. We do have OMH had started a 988 listserv and a newsletter, and this just allows us here at OMH to really be able to communicate with any interested entities, stakeholders, advocates, law enforcement partners, what's happening with 988 in the state. So there will be a link to the listserv if you haven't signed up for it and you're interested in receiving updates. It's a great way to receive that in a timely basis. We also have newsletters that the community education and marketing subgroup has put out that just provide that basic education on what 988 is and how to connect to it, the difference between 988 and some of the other 3-digit hotlines, and what happens when you call. So those are some of the topics that we've had so far. Next slide. We've also started a 988 webpage on the OMH website. And this can link to the different SAMSA and NASHBID websites as well, but this is a repository for where you can find some of the 988 updates in New York, updated PDFs of the infographics that we'll be sharing, requests for translation if you are in a community where there's a primary language that is not English. We have up to, I believe, the top 10 languages in New York to be able to have this information translated to share and educate in the community, and then other resources on the website. So that's the link there. Next slide. SAMSA also offers some resources, so these will not be specific to New York State or have the New York State logo on them. But if you were to go to the SAMSA website, which is included as a resource in this PowerPoint, you can order things like magnets, wallet cards, posters. They have safety plans, like that prescription type pad thing, which is kind of cool. And then other social media and digital shareables. So if you were interested in being able to share or educate on 988, you weren't quite sure how to best talk about it, you can go to these resources and be able to get some of that information with different talking points, digital campaigns, and things to share. This is one of our new resources for New York. So forthcoming resources that OMH will be putting out include an FAQ sheet just on what 988 is, how to access it, what it does, what it doesn't do, a 988 brochure, palm cards, magnets, and other social media graphics. So the last slide kind of gave you the national resource and just what SAMSA is doing. This slide is showing you a bit of what the New York specific branding will look like. And just sharing 988 as a resource, starting that conversation of being able to just say if you're in crisis, if someone you know is struggling, if you don't know how to help somebody and you want to get tips on how to do that, you can call 988, you can text to 988, you can access chat through this website, and just know that there is a resource for individuals who just need a little bit of extra support available literally at their fingertips. This is a bit of the marketing timeline from SAMSA and Vibrant. SAMSA really did not want states to widely advertise 988 prior to the launch in July. So a lot of that information that was being shared was really just that education 988 is coming. It's a 3-digit number. It's the NSPL, but easier to access. And now we'll be moving into this post-July first year launch of 988 to really do some research on who isn't using the service, how can we best access communities and provide that support for them, and then move into more of the 2023 timeframe, some of those large scale advertisements. This is just the New York's marketing timeline. I talk a lot, so I apologize. Does anybody have questions on 988?
Thanks, Kat. This is Kathy. And just wanted to remind people you should have the ability to unmute yourself, but you can also feel free to enter any questions or comments into the chat box as well. Just a request to get the link to be able to sign up for the 988 newsletter.
Oh, sure. Yep. I can put that in
the chat.
I can do that.
Thanks, Kat.
It comes up a little odd. So it's when you click on the link to sign up for the newsletter, it will be it should populate as an email, and you just send an email to the blank email to that address that pops up, and then you'll be on the listserv. So we've had some questions about that, but it's actually pretty easy. Kathy, we do have a couple other slides for if Denise wanted to touch on the crisis stabilization piece while I look up the link, if she's still with us.
I'm here.
There she is.
Sure. So, when we were talking about somewhere to go, some crisis stabilization centers are a newer program that's being developed through the Office of Mental Health and the Office of Addiction Services and Supports. So this is we recently submitted or published an RFP for the development of 12 of these programs, the intensive programs across New York State. And then also we just published an RFP for the supportive ones, for 12 supportive ones across New York State. So we identified 9 awardees for the intensive that will be under development, and we're looking forward, to those being live. Now, the intensive crisis stabilization centers are more of a behavioral health urgent care model. So what's included in those programs is like a triage and assessment to make sure to understand what people are coming in for, what kind of services they may need, and then a connection to those services within that urgent care center. So it could be counseling, it could be some de-escalation, it could be peer support services. Peers are really critical in these programs. So individuals with lived experience are available in these programs to help talk with individuals about, what's happening with them, to help them understand that there's hope, that there's opportunity for them to listen and help them identify the things that they may need to help get through this. The encouragement of, people who, identification of people who can help assist through a crisis and invite them in to help support them. There's discharge planning that's included, and also in the intensive crisis stabilization centers are psychiatric diagnostic services, the opportunity to, if medication is needed, the prescription of medication, whether that's for a substance use disorder or for mental health, that there's mild to moderate detox, withdrawal services. So a whole range of services, but it's not just for individuals who are having an extreme behavioral health crisis. It could be someone who's just having some anxiety or needs help connecting to services. It's for children and adults. So the opportunity for the development of these programs as part of the system is quite different than how it's been in the past. The supportive crisis stabilization centers have the ability for triage, for de-escalation, counseling, connection to services, discharge planning, but they also have to have a direct connection to those treatment services. So they have to have a direct connection to detox services, to psychiatric services, because that's part of just the larger crisis stabilization purpose. So they may not be provided on site, but they have to be able to make sure that people can get to them if they are identified as a service that they need immediately. So that's kind of the difference between these types of programs. And it's also, the development of them is based on the needs of the community. So not, these services should exist where there are places for individuals to be connected to, because they're not really they don't provide every service. They don't provide clinic services. They provide just a urgent care, stabilization, and then a move on to a next service or next level of care. So they're open 24/7, but individuals stay less than 24 hours. So that's that's really the idea of these programs. And they're a fairly new idea. So does anyone have any questions or comments or thoughts about any of these services that are under development? We would love to hear, your thoughts about this. I mean, the connection between, uniformed personnel, law enforcement, and crisis services is so interconnected and always has been, but it's the conversation has changed a bit. It's like, how do we help support each other? How do we help provide support to individuals who may need, more serious services, but come across, law enforcement before they do a crisis services, before they come across any type of crisis services. And how do we help support each other and make sure that individuals are, getting to the right place? So we'd love to hear what you think about this and how you think that you kind of fit into this picture.
Yeah, Denise, this is fantastic. Thank you both so much. I'm wondering out here to the sites, if y'all are familiar with these different crisis services in your area, and some of these newer ones. I mean, obviously you have maybe mental health officers or folks that you're working with that are doing this, but can we hear from some of y'all out there? Yeah, you can just unmute yourselves. I think if you can unmute them, Kathy.
Yes, everyone should have the ability. If you can't, if you want to just raise your hand, I will definitely unmute you as well if you're trying and having some issues. You did get some comments in the chat box as well.
Okay, chat's great. Okay, so we're hearing that these are great ideas. Okay.
Hi, everybody. Christox PD here. One question that's come up about the stabilization centers that I haven't gotten quite a clear answer on is how does this play in with the mental hygiene law, the 941, 939 requirements that police officers currently have to take someone to a 939 receiving facility?
There was a change in the mental hygiene law, I think not this past year, but the year before, that allows, that was related to this, to the development of crisis stabilization centers, that allows law enforcement to bring individuals to these crisis stabilization centers. Now, it's a voluntary. I mean, that's the most important thing, is that these are voluntary programs. If you were going to bring someone to, you know, there has to be some kind of identification that it's an appropriate service, you know, for them to go to, but it's allowed, but it has to be voluntary. And I think part of the understanding of whether it's an appropriate service or not is the inclusion of you in the planning. You know, crisis stabilization centers should be going through a planning process where they're including anyone who may have some type of connection to these services in order to get your feedback, to understand your processes, to come together to understand and educate each other about your challenges in this, like who goes there, how do you make a determination who goes there, who makes that determination, and to have those, and to talk through it, because these are not going to be successful if they do not include, you know, all potential folks who would you know, touch it, like schools and law enforcement and EMS and other, you know, treatment programs, housing, food, those kind of, you know, a whole community should be involved in, and they should be involving them and getting feedback and the development of that. Does that make sense? And if you need that, if you need the information about the mental hygiene law and the 941s and the 945s and crisis stabilization centers, we can get that for you.
Yeah, absolutely. That was helpful. I think these are great ideas, and they will certainly be a benefit to all communities that have access to them. It's the differentiation between voluntary and compliant that is a little bit of the issue there. So that we teach, you know, recruits to the police academy, the concept that ultimately you want to gain compliance no matter what, right? Voluntary compliance is what you're going for. But the concept is that you could have someone that's compliant, but they really shouldn't necessarily be considered voluntary if they meet the statute for that 941. So if you have a person that's experiencing crisis and they are suicidal, you want to gain their compliance, and that's great, but do you really want to consider them voluntary at that point just because they're agreeing to go? They really are at that point an involuntary person that must go. Does that make sense? It's a little contradiction to what we've been teaching police officers.
Yeah, that sounds like it would be a contradiction. And one of the things would be, I guess you would have to talk about that. And it's really like involuntary, because you have to remove them and bring them somewhere. But if the person says, you know, if you say, here are some choices for you, you can go to this, you have to go somewhere, right? There's the involuntary part. You're going somewhere. Where do you want to go? Do you want to go to this crisis stabilization center where they can assess you and make a determination, or you want to go, you know, to the emergency room? Because if you have an intensive crisis stabilization center, they can't reject that person. They're not going to show up and then say to you, oh no, we can't take them. They're going to take them and they're going to do an assessment. And if there has to be another transition to some other place, then that'll happen afterwards. But they should accept them. I mean, that is the intention.
Do you know how that process would work? So let's say it's the situation where a person is compliant and the decision is to go to a intensive crisis stabilization center, and then at some point something comes into play where they would be admitted to a 939 receiving facility. What would be that process to them move them from the one location to the other?
I think that depends on the community where they live, like what the options are for for moving them from one place to another. It might be an ambulance maybe, or in the meantime, there should be some work being done at the Intensive Crisis Stabilization Center and a hospital to make arrangements to accept them, right? So it wouldn't be, I'm just gonna take them and sit in the emergency room with them. It's that this person is coming. We've made a determination that they will need an inpatient stay, and they're gonna move them into that, move them that way. That's part of that coordination in the community too, between the intensive stabilization centers and hospitals. Like, how are they going to make those transfers? How are they going to accept that determination by the doctor at the intensive crisis stabilization center that they need to be admitted? So those are the kind of things that have to be worked out between those two systems too. Because we don't want law enforcement being stuck in the middle of these kinds of things where you're sitting in an emergency room waiting after you brought them to a stabilization center. That is not what we want at all. But, I think everything should be done to make sure if you bring someone in, that they're stabilized as best as they can, and the determination made about their next step. So I think there's a crisis stabilization center in Suffolk County, the Dash Center, and I think that their hospitalization rate is very, very low by folks who have been brought in there. So that's part of the community planning that is going to be critical, I think, for these programs to be really successful, as there's just a lot of bases they need to cover before they can be operational, to make sure that they're make sure these linkages are true, right?
So I put the link into the chat box for the announcement of the 9 awards that went out for the intensive crisis stabilization. Robbie did point out that there is no mention of the Capital Region. The Capital Region was not issued a intensive crisis stabilization center through this process, and New York City was allocated to have 3 centers, and only 1 award went. So there will be a reissuance of an RFP in the future for this intensive crisis stabilization center for the Capital Region and 2 in New York City in the economic development region. Good catch, Robbie.
Kat and Denise, thank you so much. I know we are right at 3:00. And just, yes, as a reminder, we have recorded today's webinar with the permission of Kat and Denise. We will be sending out that recording after today's webinar along with the slide deck. So if there are any additional questions that do come up, please feel free to contact your CARES Up project manager, or to be able to help facilitate getting those questions to Kat and Denise. And we just want to thank everyone again for attending, and a huge thanks to Kat and Denise for your time and all this great information around all the hard work that is happening around the crisis transformation in New York State. So thank you again.
Great, thank you.
Thank you.
It's great talking to you.
Thank
Thank
you all
you,
for your
everybody.
service. Take
Bye.
care.
Bye.
Take care.
Thanks.